University, along with Abdulla Morsy and Mariam Eldin, Amr Salem and Merna Mohamed. We were honored to present at Siemens Healthineers Innovation Think Tank Challenge. Thanks to Dr. Aya for all the help and guide and support. Thank you so much. So we were asked to come up with a few ideas that would really help the healthcare system in Egypt. From there, we proceeded, we came up with more than 30 challenges. We were able to narrow down them into a few broad keywords, into main 3 keywords, which were accessibility, reachability, and most importantly, digitalization. From there, we came up with 3 main ideas. Those were a representation of the few PowerPoints, then to the facts and figure of Egypt. So we have a population that's pretty dense. Mainly it's more than 100 million around the Delta region. Our demographics is mainly of younger population. Our healthcare is mainly out-of-pocket expenditures, and we have almost 8 physicians and 14 nurses per 10,000 population. Okay, so before going to the ideas, I want to reflect on something. So whether we're doctors, relatives, or even, God forbid, patients, how much time do we spend on the healthcare system? How much time do we spend and look for a good physician? And when finding one, how much time do we really spend in the process of the paperwork? And how much time do we spend in finding good hospitals? When done, how much time do we even spend on providing the appropriate medical history needed to provide us with the management needed? I believe much of us would say much time is spent on the process rather than on the visit itself. And that brought us to the ideas that Abdullah will present.
Okay. So we came up with some innovative ideas that may help digitalize the Egyptian healthcare system. We had a lot of ideas, and then we evaluated them on a graph. Then we will talk about the the 3 important solutions that will have the most significant impact in the Egyptian healthcare system. First of all is creating a national digitalized medical database. This database will be linked by a QR code to every citizen's national number. For example, if you are a medical personnel and you scan this QR code, it will direct you to Mrs. Jane Doe format or file. This file have Mrs. Jane Doe's information, her full name, national number, age, past medical history, past surgical history, and even her previous laboratory and radiological studies. This will save a lot of time wasted in history taking or even during data entry. We should emphasize that this digitalized database will be secure, and only some medical personnel will only have accessibility to it. Also, this QR code may be linked to the national ID, or even for the elderly carried in a bracelet or by a card in the wallet. And when the person goes to any hospital or a clinic, it can be scanned, and then all the previous studies may appear. And here is a flow chart to implement this solution. Secondly, the ICU Finder application. As we all witnessed during the COVID era, a lot of us found it difficult to search for ICU beds. Here with this application, we can scan the application and search for an appropriate ICU with the desired criteria, either intensive care unit, intermediate care unit, mechanical ventilation. This will save a lot of time for treating the patients rather than wasting time for searching for an empty bed. Lastly, the TeleDoc application. TeleDoc app, its main goal is to decrease the incidence of complications rather than treatment. For example, first of all, this TeleDoc app will be linked to the digitalized database that we talked about in the first solution. For example, Mrs. Jane Doe has hypertension. So she should take her medications 3 times a day. The application will send her an alarm at the desired time for her medications to take the medication. So if she forgot to take the medication 2 to 3 times, the app will send her an alarm. Please take your medications. If this is repeated 2 to 3 days, maybe this will send an alert to the healthcare worker responsible for her, and they may pay her a visit to tell her about the importance to stick to the treatment. So, for example, as hypertension, this will decrease the incidence of hypertensive stroke, so money will be spent on diagnosis rather than treatment of diseases.
With the use of ITT methodology, we were able in just under a week to, in the span of 1 week to, through multiple interactive, highly comprehensive and multidisciplinary sessions to critically analyze the major problems and setbacks in our nation's healthcare system and to cluster them together in order to determine the key underlying defect and come up with well-formed and structured solutions that are ultimately channeled to creating a more digitalized healthcare system. So this diagram represents how our 3 proposals can be integrated in order to provide an advanced, in-depth patient database that will be continuously updated to keep track of the patient's healthcare records, including their pathology reports, laboratory results, and imaging, and will be made readily accessible to healthcare professionals across multiple institutions through a standardized national QR code that will be made for each patient, and also entail features that will enable us to ensure patient compliance to screening programs, which to determine for the early detection of various patients at risk, for the implementation of preventive medicine, and also to monitor patient compliance to the different treatments and checkups, with the overall aim of decreasing disease burden and prevalence. Lastly, the ICU finder will be integrated in order to pinpoint and identify patients who are potentially in need of intensive care, and when and if the need arises, to efficiently and rapidly locate an ICU and an intensive care unit for the said patient. Lastly, where does Ain Shams stand in its current status for digitalization? Firstly, the Ain Shams University Electronic Hospital, or Virtual Hospital, which was first established in 2016, had recently, just a year ago, received international accreditation from the URAC. It's the first hospital outside of the U.S. to receive such accreditation, this was done a year ago in the light of the COVID pandemic, which had stressed the importance of remote healthcare. And right now, Ain Shams has intensified its telehealth services through apps such as CDoc, and it's currently taking steps to creating an electronic hospital information system, which will make it the first governmental hospital to create an electronic database. Thank you.
Thank you so much. Okay.